Good evening, everyone. I'm Ujjaini. I welcome you all to our little congress of film lovers and mental health workers that we are. Our discussion today is called Mental Health During Pandemic in Films, organized by JNU Center of Social Medicine and Community Health Film Club. We are a small group of research scholars who otherwise meet and discuss public health issues in films, and we also screen films and popular cultural entities. But since we are currently in a very twisted time, it has been more than a year that we could not meet in person or have a physical screening of a film. So, as the new norm goes, we decided to digitally upgrade ourselves and hence arranged this talk today. Though I thoroughly believe that the physical presence, the togetherness, or the touch is of utmost importance when it comes to discussion of mental health, but our contemporary state of events is not allowing us to do so. Anyway, fortunately, we have uh, quite a number of you together today, though digitally, but still together. We have our prominent guests also who will discuss three major themes for us today. Firstly, we have our very own Professor Acharya, who is going to talk about mental health in films. Then we'll move on with Anindita, Miss Anindita Biswas from Austin, online support team for Every Mind. She's going to take us through the general mental health issues during the pandemic, like the lines of guilt, blame, self-harm, touch starvation. And finally, we have Dr. Sunaina from the Department of Psychology from Ambedkar University to enlighten us about the mental health among students. After the talk, a question answer session will follow. And the question answer session is also a session where we can consult our concerned speakers with our queries. So if you have any confidential query, you can always go to the participants tab on your Zoom screen and personally drop a message to the concerned speaker so that she can see your query and represent you anonymously in the session. So I would welcome my friend Vishnu now to introduce us to the talk today and also to the film club. Vishnu, please take over.
Hello, everyone. Welcome to today's talk organized by the CSMCH Film Club. Let us have an introduction to the Film Club. The center level GBM on 26 February 2019 has decided to form a film club for nightly movie screening in the center. The club is to create an open platform for students to discuss and interact with each other on health and other social and political issues. Currently, we are now 8 members. They are Srikumar, Sumanta, Kazim, Barnali, Gunjan, Ashrarul, Shilpi, and Ujjaini. We have screened Sairat, Ganashatru, Virus, Animani, a 12-year night, and Article 15 in our center, and had a discussion on the topics that are covered in the film. And the Article 15 screening on the campus was a big success as the director, Anbar Sinha himself, was present in the panel. As we all know, the second wave of the pandemic has devastating health ramification in India. This is not limited not just to the health, but has long-lasting effects on the social and economic aspects of the country. Amidst the pandemic and interventions to deal with it, the hidden epidemic of mental health is augmenting unnoticed. The implications are across the socio-economic groups, and students are not untouched. The reason the Film Club of the Center of Social Medicine and Community Health, JNU, is organizing this talk is to discuss mental health during the pandemic and in films. The purpose is actually to take an initiative and a dialogue to break the stigma of mental health and among the student community in specific but not limited to. It is to start conversations and change experiences of service providers and users apart from discussing mental health in the popular culture. Thank you. Over to you, Jaylee.
Thank you, Vishnu. Now I'll invite Professor Acharya to talk to us about mental health in films. But before that, I would introduce her to everybody here today. She is our professor at our Center of Social Science and Community Health of School of Social Sciences in JNU. But she has also served as a director of Indian Institute of Dalit Studies, New Delhi. She has been a visiting fellow at many universities worldwide. In 2005, she was awarded the Asian Scholarship Foundation Fellowship. She has delivered numerous lectures, chaired sessions, contributed to national and international conferences in various institutions within the country and also abroad. So her research includes health and discrimination, vulnerability among youth, gender in urban spaces, caste, gender intersectionality, and she has published in national and international journals and has 3 books to her credit. One among them is, of course, of immense relevance to our session today, is that of young people and HIV/AIDS, some social themes in Hindi cinema in India. Thank you, Professor Acharya, for joining us today. Please take over the session.
Thank you so much, Ujjaini, for introducing me with such eloquence. I'm sure to me, it's just another phase that you've kind of shared with the rest of us. At the onset, I really wish to congratulate all of you. It's really a pleasure to see you all, like you said, digitally, but connected in these difficult times. It's really a pleasure to see you all getting together to continue with what your basic role is as students of public health particularly. And I'm sure nothing could have been more appropriate in these difficult times to talk about mental health that kind of we are facing today vis-a-vis the pandemic. So thank you very much for inviting me for this session that on which you have specialists from the area. For me, it's more like because of the interest that I have ventured out in looking at texts which are from literature, from films, and even from dramatics. So as part of that, perhaps you also have instigated me to talk about something which I really like doing. So thank you once again for that. Coming down from there, like Jenny says, and this is part of the larger public health fraternity, the film club per se, I would want to draw your attention to this report, Better Mental Health for All, which was published in 2016. By that report, public health practitioners are supposed to prioritize and advance public's mental health. And we know very well that's what the WHO definition is. So I think when we put all of this in some kind of a backdrop, pandemic becomes, to my mind, the core of the conversation, not only for this forum, but also beyond this forum. When we talk about pandemic having impacted on people and people's life, I would want to argue that very, very simply, I would like to put that pandemic has affected the lives of people directly and at the second level, it has impacted indirectly. When we say that the direct impact of the pandemic, particularly in the light of what it has done to the mental health of the individuals, mental health of the people, the very fear of the pandemic has kind of triggered a plethora of feelings, plethora of anxieties that the individuals would be facing. So the very fear of infection, the degree of infection itself, whether I am infected badly or I'm infected just about mildly, makes the lot of difference. What is it that's going to happen to me when I reach the hospice, when I reach the care providers? Do I get the care? Do I not get the care? So the anxiety which gets built in by this very idea of the virus itself, not knowing about the virus, information which is there about the virus, yet not comprehensible by a common person. So some of these aspects have made the very direct impact on the people's mental mindsets, if I would probably want to use that term. And over and above that, what happens to the post-COVID scenario? What happens when hopefully we sail through all of this, and then what happens? Then the next thing which comes to my mind when we're talking about the pandemic is one of the measures of the pandemic has been to stay home, right? Now, staying home, we know by now, literature has ample evidence to tell us, has had very negative impact on people who had to stay home for various reasons. For example, if those of us who've been working in the area of domestic health, domestic violence, we know that there is a surge in domestic violence during the pandemic time, particularly the time points 2019 and 2020. There are evidences both from the NCRB and from the National Commission for Women. Similarly, stay home has been very, very detrimental for those of us who have been in informal sector. And we've seen their plight come out very, very thoroughly with our stark evidences when we talk about the migrants and the realms in which migrants had to do without, they had to leave the cities where which they had considered as their place of work. They had adopted the cities to earn their livelihoods, and then they had to leave without much preparation. So that is another stress which the people as workers in the informal sector experience. Then the other aspect which I would want to probably table here, the very idea of lockdown itself. The preparedness which was not there, or rather the unpreparedness, and I would say it very, very consciously, wherein we had to kind of just get into the state of halt without preparing for how to deal with that halt. So these were some of the aspects which showed their realm, showed their impact on the mindset, on the mindset of the people, as we kind of lived through some of these scenarios. Taking this forward, perhaps I would want to argue also, therefore, that there have been some indirect effects of the COVID, which many of us would want to connect with some of the direct impacts that I've just talked about. For example, when we are talking about people in the informal sector, the loss of work itself may not really be in the kinds of sickness or sickness-induced mental illnesses or mental conditions, but loss of work per itself therefore becomes something which is relevant in terms of recognizing that pandemic has impacted the state of mind that individuals have experienced because of loss of work. The second aspect which I would want to bring here is more connected to those of you who are sitting in the classrooms, or rather missing sitting in the classrooms. The very quantum of students, I would want to say, or rather to take it slightly on the larger scale, the very transaction of teaching and learning, which has been affected because of the pandemic, for the simple reason that the activities wherein we needed congregation of people, wherein we needed contact, wherein we needed immediate touch with individuals, close proximities with individuals, those activities came to a sudden halt. And with that halt followed the uncertainty, when would this halt will get over. With that came the uncertainty of these stresses, giving way to the stresses of incomplete teaching, incomplete assignments, incomplete examinations, incomplete sessions in which I was perhaps sitting as a student, or I was doing a classroom, or I was doing a session with the students. So some of these anxieties have had their repercussions on the mental conditions of the individuals. And we are seeing this not only happen in students across the stages of primary, secondary, and tertiary levels, we are also seeing among the teachers also. Think of the school scenario wherein those young children who till yesterday were stopped from looking at screen. Their screen time was very, very strictly monitored by their parents, especially if they were younger ones. Now here is the situation where parents themselves are sitting there telling them to sit in front of the screen because the classroom teaching is happening. Now, what is happening? What is going to happen to these children, who, especially the ones who've just entered the school? The two things which I see as happening: one, that the feel of getting inside the classroom, the feel of entering my school is completely missing for these children who are the new entrants into the system of education. Next, whenever we open up, these children will have a different kind of crisis to recognize what the entity that is school can be, is. So that again will be another kind of situation wherein we'll have to deal with those young children to ensure that this is where in reality the classroom exists, and the classroom activities and the classroom interactions have to kind of take place. Secondary school, again, it's a similar kind of situation. College teaching, again, there is a similar kind of situation. Something which perhaps I would want to share here with you is when I was in a similar kind of occasion talking to the students of a degree college. The very idea of online teaching, we've all been experiencing the issues which are there in terms of connectivity. Over and above the issue of connectivity, the other thing which becomes very important for girl students is possessing the very gadget through which they can do an online classroom. This college, which I'm trying to refer to you, had students for whom owning or using, forget about owning, using a phone was prohibited because लड़कियां बिगड़ जाएंगी, and this is somewhere in the eastern part of UP that I'm referring. Okay. So with those kind of notions, online teaching on one hand, as claimed in the new education policy, has brought in the classroom to the student. It also has its own perils which we are still trying to deal with. We have no answers to many questions which we have been struggling to talk in terms of modifications in the syllabus, so that students feel comfortable in doing in learning, quote unquote, what they're supposed to be learning, what they opted for when they join the schools, the colleges, and the universities. So what is going to happen, the scenarios like this? As a student, I had an imagination of something that I will achieve by doing a particular course. Now, in the light of the changes that have happened vis-a-vis the pandemic, I'm not going to learn what I had envisaged I will learn, and so on. Very recently, I'm sure some of you may have already had a chance to have an exposure to this. There's a documentary called Alma Matters. Some of you may be familiar with it. Now, this documentary is actually talking about the institutions of higher learning, IIT Kharagpur particularly, the aspirations with which students come into such institutions of higher learning, and what exactly they go through in terms of the very, very bracketed way of allocation of courses that they are deemed to be suitable for, over and above the choices, over and above the interests that they may be wanting to take on. Counseling plays a very important role in ensuring that they get what they are suitable for. Like that counseling takes an upper hand in terms of the interest of the student that they could be having. So the point I'm therefore making is that the portrayal of some of these situations, some of these scenarios have been fairly well dealt with with cinema per se. Cinema, I'm sure we'll all agree, is a very strong medium of dissemination of information. And therefore, the moment we try to use it, uh, and as conscious, perhaps public health students, we ought to be training ourselves in such a way that this medium can be best used. Some of the references or some of the examples that I would want to share with you at the moment. If we take on board the very narratives which we see from the cinematic portrayal, both in the regional cinema, in the Hindi cinema, in the international cinema, it is we see that the range of themes which cinema picks up is from historical to religious to interpersonal relationships, family dramas, politics. Something which has really become a core theme, fairly well inducted in the Hindi cinema particularly, and I can recall some of the films of the 60s, like Khilona. I'm sure this is a film which portrays a mentally retarded male protagonist who is kind of kept in the care of a singer, and the presumption, the stereotypical prejudiced presumption that once he comes in contact with a woman, his ailments will be overcome. So the point I'm making is cinema and the portrayal in the cinema have also changed from the times earlier than as compared to what the portrayal is today. Earlier times, the portrayals were very melodramatic. Very often, they messed up the factual information on the illness or on the conditions, and they were more of the the realm was more in terms of entertainment, whichever way that was possible. Slightly better portrayal is visible in another film, which I think is in the 60s. Some of you might recall the name if you're interested in cinema and mental conditions. This is Khamoshi. Not the one which your generation would be familiar with. This is the one of my generation, which had I think Rajesh Khanna and Waheeda Rehman. There, the portrayal is done through the relationship between the care provider and the care seeker, and how intense is that is that intent to provide good care to the care user or the person who is unwell, leads to the very condition of illness to the care provider herself. So that, again, there is melodrama, no doubt about it, but the idea is some kind of reflection through the sincerity which is being portrayed through these characters. And then in recent times, I think, which you probably would want to think about is Tare Zameen Par. Now, it certainly is a condition which many of us are familiar with, the dyslexic conditions. In fact, I have a colleague from my earlier institution who has a child with dyslexia. And of course, the degree of the illnesses will decide how the care provisioning has to happen. So the portrayal in the cinematic, the point I'm bringing in Tare Zameen Par here is to kind of suggest that over the period of time, the portrayal of such conditions have gone closer to the real kind of situation as they were in the earlier films, initial films, for example. The other realms which perhaps have also captured some kind of issues vis-a-vis a mental illness is another one is theater. In fact, one of the theatrical presentations which I recall very well is called Jan Rahasya. I mean, it's a play in Hindi as well as Marathi, written by Dr. Anand Nadkarni. Now, here is a portrayal between the relationship which is happening between the mother and the daughter. And the mother is unwell due to certain mental conditions, and the loss of father is triggering out this kind of association between the mother and the daughter. And cinematic portrayal versus theatrical portrayal, there are technical differences also, which I'm sure we can discuss at some other time point. But the relevant thing over here is that the condition which provokes that kind of retaliation, which induces that kind of behavior, which is labeled as, if to begin with, non-conducive to the normal behavior. And that's where the genesis of any genesis of the recognition of any condition which an individual could be facing can be considered as a point to reckon with. Hindi cinema, particularly, if I get back to, one of the trajectories in Hindi cinema has been the young population. The young people, in fact, the theme of young people perhaps cuts through all other thematic concerns that the Hindi cinema particularly could have been doing. One of them that I would want to talk about is Three Idiots, closer to your hearts, I'm sure. One of the characters from this film, which I feel becomes very relevant in what we are trying to discuss here today, is the character, that student, if you recall, is reprimanded by the principal, and he sits by the windowsill and sings the song, "Give Me Some Sunshine," right? Now, what I want to make us think about is, what is it that is happening to this character? What are the feelings that this song is invoking in this character? And if you recall, if you've seen the film, you will recall that this is one character who ends his life in a suicide, right? So the stresses of education in higher institutions of higher learning can lead to the individuals to take such morbid steps. That was the point, perhaps, which I was trying to make when I reflected about alma maters. And I'm making this as a point also here because if you look at the UGC report on the suicides committed, or it was basically on the conditions of the students in institutions of higher learning commissioned by the UGC. The time period, if I recall correctly, between 2013 to 2017, there were 27 suicides which were committed by these students in the institutions of higher learning across the country, and therefore the point here is that there were various reasons which had triggered these steps into these students. One of them was the feeling that becomes the ultimate to trigger the point of suicide, where you lose hope in terms of being able to revive yourself, in being able to repose that faith in yourself that you'll be able to do what you're expected to do. So that is something which becomes very, very important when we are dealing with the young people. Now, relate these young set of people who have lost their jobs during the pandemic, who have, and that cuts across all kinds of jobs across, particularly in the informal sector. Formal sector has been saved fairly well because formal sector did not bear the brunt in terms of loss of that money which we necessarily earn every month or every day. Whereas in the informal sector, even while we talk about the waged labor and the perils of the waged labor in terms of not being able to earn the daily bread, even for those who are at the higher echelons, many of them are distressed because of the fact that the source of earning has stopped. And by this stopping of the source of earning, what has also happened that, because I'm talking about those at the managerial levels, those of them at the managerial levels have kind of so the point I was making, therefore, in the young people, the realms of those who have lost jobs at higher echelon because they could have, taken the loan for their vehicle, taken the loan for their housing, the distress which has been therefore gotten into because of this condition is something which we really need to take note of. Another thing I would want to put in over here is that when we talk about health conditions being portrayed in the films, HIV/AIDS was one of the conditions which a good number of films have portrayed. And I would just want to talk about one small feature film format which UNICEF had used in its programs for dissemination, because this film, which is called To Tear with Love, portrays the realms of young people and their engagement with lifestyle habits which lead to getting into the realms of HIV/AIDS, then the interspousal relationship, and then how the community treats the children who get infected. And this is partly based on one of the cases which was reported from Kerala, wherein two twin sisters from one of these schools were asked to leave the school because of their HIV positive status. So I think that was the reason why.
Ma'am, can you repeat the name?
Hello?
Ma'am, can you repeat the name?
To Tear with Love. It could be still there in the website of UNICEF. Right. So the idea was to bring on board what is happening to the young people when they engage in lifestyle behavioral aspects, what happens to interspousal communications vis-a-vis physical intact, what happens to the community, or how does community react to the children who get infected. So this was since it captured these three aspects, UNICEF was very interested in putting this film for their dissemination purposes. Another film which marked this HIV realm was more from the feature film perspective, My Brother Nikhil, which traces how in the beginning the HIV infected individuals were treated like criminals. They were isolated, kept in chains, etc., etc., which is true till about late 80s. This was the scenario which was happening, and the protagonist. This again is based on a real life story, which is of a sports person who kind of gets infected because of homosexuality, again, one of the lifestyle. Anyway, so the point therefore I'm making is to be able to, films as a medium has a very important role to play in capturing how lives have changed vis-a-vis the pandemic. One of the recent documentaries, which I'm sure many of you are already familiar with, is 1232 kilometers. Some of you may have already seen. Now, to my mind, this is a very, very timely and stark portrayal of the condition of the migrants. And to my mind, this is a narrative. This is a very, very ethnographic narrative, which the filmmaker, who happens to be Vinod Kapri, has brought in terms of tracing how these individuals who had to leave the city of Delhi to reach their respective villages in Bihar took the various courses, hid themselves from the police, got beaten up at various places, were given food by certain good souls, were said no by certain other individuals. The whole tracking, it's like what you are taught to do as an ethnographic note is what this film is doing from the cinematic portrayal, from a medium which is cinema. So the point is that, the point also that I'm making here is, in this film, the portrayal is far more closer to the reality, as perhaps, if I can compare it, what Khilona was trying to do with a person with certain kind of mental illnesses. a good number of films which have talked about dementia, and I want to make a comparison between what is happening to us vis-a-vis the pandemic versus dementia. Now, if you look at dementia, there are a good number of films from Black to Astu. Astu is it's a very interesting film. You might want to. It's a Marathi film which is based on the story of an elderly of the father who kind of gets affected by Alzheimer's, and has the narrative is all about him, how he kind of returns home after the whole travail where the young child, grandchild is involved, the son and the family is also involved. Um, the point here is one more, which is that it's not only those who are directly impacted by the perils of the pandemic vis-a-vis what I'm labeling as direct and indirect effect. It's everybody who's connected with these people who have been impacted. Say, for example, if I had contracted the infection, everybody around me, from my household to my community to everybody that I had interacted with, gets affected in one way or the other. So we were talking about the screen time. Think about the issues that the eyes are going to have vis-a-vis the extended screen times that we are making use of. Think about the body sitting posture, body postures, and what does happen to the motor abilities in our case. Now, so what the point therefore I'm trying to make for us is, if we believe that film is a very important medium to disseminate information, to talk about, to convey to the common man. And I feel it is very important, because when we talk about the guidelines of pandemic, the do's and don'ts of the pandemic, I'm sure even when you and I pick it up from the ministry's website or from those big documents, it takes us time to understand what exactly is being said. All the more when every second day the guidelines are changing. So you can imagine what happens to the common man who can be absolutely threatened for being not aware of anything. So this can be a media wherein simple translations, meaning to say, how do I convey the do's and don'ts in simple visual, simple terms, simple language to somebody who will be able to understand why is it necessary to have a gap of 28 days, for example, between first dose of the vaccination and the second dose of the vaccination. If you ask me also, I think I will not be able to explain why is it that 28 days per se is important and not 27 days or 29 days. All the more when we are now reading about how UK has reduced the gap for the Indian, because on the assumption that Indian strain is becoming more virulent. So there the gap has been increased, whereas when we think about our realms, we have increased the time period during the two doses. So the confusion that I will have as a common man, how does that get suppressed? Guidelines perhaps will be there, those documents will be there, but as a common person, where do I look for a simple explanation of these aspects that I would want to think about? We already know that COVID has done, I mean, the economy has been hit tremendously. We are already between 5.6% to 5.6 to 6% loss of the GDP, if we can really talk in terms of that loss. The only saving grace, what SBI says, the State Bank of India says, that the loss that we are going to incur in the second wave is going to be comparatively a short time kind of a thing, and the revival will be better. So let's hope that the revival will be better, because all the more perhaps because we do see that the numbers have started to reduce from what they were 4 lakhs plus on 6th of May to something to the tune of 2.2 that I see for yesterday's number. So let's hope that some of these issues which need to be portrayed in order to this portrayal in some sense will also impact upon me in terms vis-a-vis the distress and the anxiety that I could be experiencing because of not being aware, which is causing so much of fear and uncertainty. So fear accorded with uncertainty is likely, I mean, there's no other way that I would not be distressed, be it the very virus, or it be the caretaking when I do not know whether hospital bed will be available, or I will get the oxygen, etc., to the very realm of vaccination. I will stop here, and I hope it made sense to those of you who are here. Thank you very much, and I'm sorry if I've taken longer time than you had thought I would. Thank you.
Thank you, ma'am. Thank you so much. And I think it will be really interesting, like you said, to actually wait for the popular culture to take up the double burden that we are in already, the economic state, the pandemic state, and also people already existing with mental health issues. How are they figuring out the time? So I think it'll be really interesting for us to look how film or popular culture traverse through all those issues. Thank you so much. Now I would like to invite Ms. Anindita Biswas. She's a Dalit psychotherapist. She's currently associated with AUSTM, Online Support Team for Every Mind. She has completed her MPhil in Psychiatric Social Work from National Institute of Mental Health and Neurosciences, Bangalore. She has a special interest in working with youth, women, LGBTQIA, and marginalized groups. So we welcome you, Anindita. Over to you now. Thank you.
Thank you, Jenny, for the introduction. And I would like to begin by thanking the CSMCH Film Club and our team of Austin for giving me this opportunity to speak on their behalf. So before beginning my talk, I would like to take a moment to acknowledge all the fear, the stress, the anxiety, and the grief that we are going through collectively, and take a deep breath collectively. Right. So mental health in pandemic is really a broad topic, and a lot are being talked about in different areas of mental health issues. However, what I'm going to talk about today are majorly based on some of my observations and some of the areas which are less talked about. So I would like to begin by talking about blame. Now, we all know that we are going through a lot of difficult emotions right now. And often we want to share that difficult feelings and emotions with our close ones, maybe our peers, our friends, or our loved ones. So the response when we are sharing, the response from the other person, if it is not appropriate, it can often result in us getting into a cycle of self-blame. So how it happens? Let me give some example of such responses. So the response might look like, you're talking about this now when so many people are going through so many things. It is very selfish of you to talk about this now. Or in a more passive way, invalidating your sharing and dismissing your sharing. And the response might look like, oh, okay, I understand, but at least think about the people who are going through worse. You're in a much better position. So what does this responses do to us? This responses, leads us into a self-talk of guilt and shame, which might look like, I am doing a very selfish thing, and I am selfish, right? So I would just like to say here that be very mindful about your responses, especially when someone is sharing something very sensitive. If you do not know how to respond immediately, take time and come back with an appropriate response and convey the same to the person, that you need time and you don't know how to respond right now, and you will come back, right? Okay, so when we are talking about guilt and shame, so all these feelings of guilt and shame can often lead us to self-harm. Now, what is our idea of self-harm? I know for many of us, the general idea of self-harm is usually inflicting physical pain upon us. But is that self-harm all about? Self-harm is not just limited to that area, but it also means that neglecting your own needs, For example, it could be neglecting your very need of hunger, not having your food in time, not taking proper rest when your body is asking for rest, and overworking, having sleepless nights, thinking about the things that you have to do, not giving time to yourself for relaxing and rejuvenating. So all these things are self-harm. So here I would like to share one of my example to make it more clear how it can look like. So this was during last lockdown when I was volunteering for a group which I'm associated with, and I was trying to arrange basic things like food and medicines for the migrant laborers who were stuck at different parts of the country, who are reaching out to me. And a lot of difficult feelings and emotions were going through me at that time. There would be often times when I would not have my own food, thinking about that I'm not able to arrange food for somebody. I actually feel that guilt that I'm not able to arrange food for somebody and having my own food. I would spend sleepless nights thinking about how can I help the people who are not getting help and for whom I'm not able to arrange things. So this um, continued, and I realized that gradually my energy was deteriorating. I was not able to sustain my health. I was not functioning properly. I was crashing. So I had to take a step back and really sit with myself and listen to my needs, listen to what my body is asking for, and then get back to giving help. So I would like to tell that it is very important for you to acknowledge and pay attention to your needs first to make the health sustainable. So here, this is where also, self-care comes into play. So self-care can be, taking care of your basic needs like your food, your sleep, and it can be, journaling about your difficult thoughts and feelings. It can be giving time to yourself for doing things that you love. It can be indulging in relaxing and rejuvenating activities like taking a bath, listening to some music, and dancing, and so on. Now, when we are talking about harm, let's take a moment to acknowledge about all the sufferings, the violence and discrimination that are taking place against the minority groups and the vulnerable groups during this pandemic. So not only the people who are the direct victims of this violence and discrimination are getting affected mentally, but also the people who belong to these groups or identify with these groups are getting affected mentally. And it happened with me as well. A lot of difficult emotions and feelings got triggered by hearing a lot of narratives which were linked to me. And I had a difficult time getting back to my own self. So I would just like to take a moment and tell all the people who are listening to me right now and all the people who are going through similar feelings that I'm here with you. All that you're feeling, all that you're going through is valid, and I'm here with you. I would like to take a quick deep breath again. Right. So my next topic would be touch starvation. So all of us know that the social distancing and isolation has deprived us from a lot of things which were present in our life. And one of the things is touch. So what are the different types of touch in our which we come across in our daily life? It can be a firm handshake, it can be holding of hands, it can be a hug, it can be a peck on the cheeks, it can be a pat on the back. So all of these things we receive from different people. It may be our partner, it may be our friends, it may be any other loved person, right? So all of us, because of this isolation and social distancing, we are missing on that. And this is something which is called touch starvation, also referred to as skin hunger or hug deprivation, right? So it is also seen, like there is a ongoing research on this, and it is seen that this hug deprivation or touch starvation can often lead to more serious problems like depression, anxiety, and insomnia. So what can you do about it, right? So I have gone through some resources and I have found some tips useful, which I am going to share with you today. So some of the tips can be cuddling a pet if you have one at your home, taking a soft bristle brush and rubbing your skin with it. And it can be hugging a pillow. It can be touching different parts of your body that you feel need care in very slow movement, giving warmth and comfort to those parts and showing your body that you care for your body and you are there for your body, right? So I know that all of these tips are not really direct replacement of what we are missing. It's not the direct replacement of the real thing, but I hope this can help us to cope with the current situation. Right. So lastly, I would like to briefly talk about stigma. And why I'm talking about stigma? Because it is a major hindrance for us in seeking help. So stigma can be of two types. It can be categorized into two parts basically. So one is external stigma and another is internalized stigma. So external stigma is basically the negative stereotypes used for different mental illness and mental health issues. And internalized stigma is when you start believing on those stereotypes and you develop a negative perception about yourself. For example, it can look like COVID-19 is making you crazy. You are losing it, right? And when you hear this coming from the other people, when you keep on hearing this, you start internalizing it. You start thinking that I'm becoming crazy. COVID is making me crazy. I'm really losing it. And what will it do? It will prevent you from taking help when you really need it. You will think that if I go and seek help, people will come to know about me that I'm crazy and not that I'm having a mental illness. The thought will be that people will come to know that I'm crazy. People will come to know that I'm losing it. So it will really prevent you from taking help. So here more and more discussions about stigma and being more sensitive and aware is what is the need of the hour. So I think I have covered most of the points which I wanted to talk about today. Before ending this talk, I would just like to quote Jeffrey Marsh. So, your needs does not make you weak. Your needs are beautiful. Your needs make you fully human. Your needs make you fully a work of art. Thank you.
Thank you, Anindita. It was so reassuring. Your approach to this work and your dedication is very, very evident from how you imparted that to us. And thank you so much. It was really a pleasure to listen to you because it was reassuring to the ears. Thank you. Now I would like to invite Dr. Sunaina K. Sunaina is currently working in Ambedkar University, Delhi, in the Department of Psychology, School of Human Studies. She has done her PhD from Zakir Hussain Center of Educational Studies in JNU. So she belongs to our alma mater. Her major research area was educational psychology, cultural psychology, political psychology, and psychosocial dynamics of gender. She largely works with frameworks of critical psychology paradigm. As a teacher or a human facilitator, she follows the principles of Lev Vygotsky to design her progressive classroom pedagogy, if I'm not wrong. So thank you, Sunena. Please take over.
Yes, thanks, Jenny. Thanks for those kind and generous words. I hope I'm audible. Am I?
Yes, you are.
Yes. Okay. Thank you. Okay. So I thank the Film Club, CSMCH, Jawaharlal Nehru University for this opportunity, giving this opportunity, and for this invite. And yes, I'm sharing a platform with Sangamitra ma'am. Itself is a moment of happiness, a delight for me, because before joining JMU, just after finishing my master's program, I presented a paper in National Academy of Sciences conference, and there Sangamitra ma'am was the evaluator. That was a poster presentation, and Sangamitra ma'am was the evaluator, and we had a nice time there. And yes, so this is a moment of great pleasure for me. Yes, and many of my friends here know that I have a lot of nostalgia about JNU. And because you know, this is one of the institution I'm, you know, always my heart, and there's lots of emotional attachment to it. And whenever I get an opportunity to associate with JNU, I don't lose it. So this is another opportunity CSMCH gave me to get associated with JNU, my alma mater. So this is a great moment for me. So yes, when my friend Sri Kumar called me up to ask me to do a session on mental health of students in this pandemic time, I was a bit puzzled. I was actually thinking how to address this issue. Shall I address this as a teacher, or merely as a psychologist, a practicing counselor, or as an academic activist? And when I started preparing for it, I realized that I cannot separate out any of my identities from the other, because when it comes to students' issues, all these identities come together and work together. Mine. So this is a disclaimer. In the next 10-15 minutes, any of these identities of mine can pop up. So please bear with me. Yeah. So before beginning, I would like to show you a small, very short video, which is of 15 seconds or so. This is a message. So this video, which I'm going to screen, is a message that one of my students sent me on WhatsApp on 18th of May. A week later, she got discharged from hospital. She was admitted in one of the Delhi hospitals in a very difficult situation. She was also infected, COVID positive. She was admitted along with her dadima, her grandmother. And we all were praying for her good health, and she recovered. And after the recovery, and from the hospital bed itself, she was texting me. She was sending me selfies with oxygen mask, with cannula on her hand, with drip bottles at the bedside. So we were in continuous, constant communication. And after the recovery, after a week later, she sent me this video as a WhatsApp message. I'll just screen it.
Hi.
So this is just a 15-second video, and she gave a caption to it as, "My friend who used to come to check on me when I was ill and still. He is my true love." Okay, so for me, this one single message from a student sums up the mental status of our students in the country. So I'm addressing the student community higher education level, I'm not talking much about the lower level school education and the students community of school education level, because here most of us, most of the audience are from higher education level, and most of us others are working closely with higher education. So that is why. So I would like to address the issues of students who are at higher education level. So yes, so there are researches happening on this particular theme, that mental health of students, mental well-being of students, mental health issues of students in this particular pandemic time. And but I would like to say that none of these researches are enough to make any authentic generalizations, interpretations, or any valid conclusions. We still need more researches, more interventions to this particular issue. But when I was listening to Anandita, and when I was working with some helpline groups in Delhi, and rightly I'm in Kerala, and from here also I work with some of the relief groups, helpline groups, and I offer counseling and small level therapies for those who struggle with this pandemic stress and anxieties. So most of my counselees, those who seek counseling from me, are college students and university students, mostly from Delhi University and JNU. So from my own experiences and from my group's experiences, from our individual level experiences, I have some observations and to share with you. So yeah, and we see this is the time of digital education, digital learning, virtual learning, and I have been seeing that there are n number of workshops, conferences, and webinars on mental health of students, and some of them are highly paying ones. Uh, this is a thriving market, I would like to say. It's mere business on mental health. Uh, and most of it, I went through some of their program schedules and some of their modules, and I realized that most of them are uh, you know uh, uh, reducing this concept of mental health to individual level, very reductionistic perspectives, and they don't address the larger level socio-political context which causes this issues to our students. So without addressing that particular issue, we cannot have a solid discourse on mental health of students in this pandemic time. All right. So how to address this? That's the question. So I can say from my own experience, I can say that uh, if I take the standardized so-called DSM criteria of mental health, the major mental health issues comes under stress disorders, anxiety disorders, generalized anxiety disorders to be specific, and many people are getting panic attacks as part of anxiety disorders and depressive disorders. Different, it's a spectrum. Depression is a spectrum, and some are getting into severe mood disorders as well. And we know that our students, when we take Indian scenario, when we take our uh, educational institutions, already our students are vulnerable community. So what I was saying is that already our students who are in the higher education level are very vulnerable to mental health issues. So there are a number of reasons for that. I'm not going to the details of that. We all know that. And I know many of my friends, I know my acquaintances are taking psychiatric medicines for the, to seek mental well-being, to sort out their mental distress. So already we are in a difficult situation. And this pandemic just aggravated those issues and created new challenges, new mental health challenges to our student community. And none of these issues are new to us. These were already there. Okay, but this situation situationally aggravated those issues, firstly. Secondly, there is no single mental health disorder or mental distress which is unique or very particular or peculiar to student community. Whatever affects the mental health of the public, the larger community, affects students as well. Students do not have any extra immunity. Students are not having any kind of insulation. They don't have any kind of extra shielding to resist this. So that's what I wanted to. That's my first argument. Students are prone to any of the mental distress which other population, the general population, also suffer. All right, but this pandemic, as a new, very novel scenario, very novel context, posed some peculiar challenges to students. All right, so which will have totally new kind of impact to students' mental, their inner world and their mental functioning. That's all. That's it. So labeling these distresses as new mental disorders of students is completely a wrong idea. Okay. So what are they? What are these issues and how are these new challenges are affecting the inner world of students? That is the question. So from my own observation and from the research works, I read the very minimal research works available. I notice that there are three factors which affects the mental health of students. One is, we all know, the digital divide. And this digital divide is not a single, very separate phenomena. It's part of the larger issue of economic disparity and discrimination. What is digital divide? Having unequal access to digitalized education. When we talk about students in this new normal of teaching, learning practices. So there also, as ma'am said, Sangamitra ma'am said, gender differences is also a factor. Okay, the access that female students have, girls have to digital platforms and access to gadgets like smartphones and laptops is not comparable with that of a male session, the male students. And my imagination is so limited to think about the situation of trans students, honestly saying. So, and there were two incidents which really shook me. The first one was the suicide of a girl student, a 10th standard student from Kerala, from my own district, Malappuram district, in the month of June. Immediately after the lockdown started and the pandemic started spreading all over the country, and Kerala government started turning public education completely to digital education, virtual learning through a publicly devised app. So there were no proper preparation. Lack of preparation was so evident, and many were struggling, and many help groups, many government mechanisms at local level were trying to help those who have issues. But this suicide case happened, and that was a shocking incident. A girl from Malappuram district, one of the most educationally backward district of Kerala, from 10th standard, committed suicide. She decided to end her life with the fear of, not having equal access to this new new mode of learning. And another incident, we all know that the case of Lady Sri Ram College students issue. She also ended her life. She was state topper, and she decided to end her life because of the same fear. And in this, and many other incidents are there. Some are reported, some are not reported. And in all these cases, they think that uh, we are not fit into the system. We are not competent enough to face the challenges of this new scenario. And they decide to end their life. And here I would like to take Emil Durkheim's work on suicide. The book he published in 1897, Suicide, a Study in Sociology, clearly talks about the social roles in suicide cases. So for me, suicides are not individual phenomena, social phenomena. Suicides are social phenomena, not individual phenomena. But most of the mental health practitioners they reduce suicides to a individual phenomenon, and they address their individual level issues as remedies. So that is not a solution. If we are not addressing the root causes of the problem, we just keep trying to cure the symptoms, and we won't be that won't lead us to anywhere. So and this digital divide creates n number of issues, from very small issue like, as a teacher I was also struggling how to handle with this. And sometimes I was taking help of students because none of us were trained to this new kind of teaching and learning. And I remember when I gave an online exam, students asked me, ma'am, can we get extra time to upload the answer sheets, because the data pack we are using is very limited, and speed is very limited, and we need extra time to upload the answer sheet. That single thought itself can affect their exam performances. That single thought can influence their confidence negatively. So this is the smallest level of issues. So from this fear, from this small anxiety to suicide, the issue has spanned. Another factor is coping up with the changing sense of space and changing sense of self, autonomy, and agency. The concept of space has changed enormously. So a student who sits inside a household, inside a room or a corner, with a study table, with a laptop or a smartphone, is totally different from that of a student who freely walks or roam around inside a campus with books, with few friends or classmates, and they have, going to canteen, sit over a cup of tea, think of nothing but everything, and freely walk into a library, freely walk into a cubicle of a teacher to clear doubts or to share concerns, share the worries. That's why the concept of spaces changed drastically, and how to cope up with changed concept of space. Students were literally struggling. So they themselves were doubting their identity of a student. What is happening here? What is this new mode of teaching and learning in this totally different space? And the sense of self. So when you are inside a household, your sense of self starts changing, because our self, the concept of self, emerges out of social expectations and social roles, right? So inside a household, your social roles, the expected roles are totally different from that of a educational space, right? Yeah, there also we can clearly see how class and gender, and in Indian scenario, caste also matters. So how this they all are intertwined in a way, and how they impact and how they give different experiences, challenging experiences to students. And I remember one of my student, she wrote to me, she sent me a mail saying that, ma'am, I won't be able to attend classes for a few days because I have to do house chores. I have to take care of my grandma, and I have to take care of my father who just recovered from COVID, and I have to take care of my siblings as well. So I won't be able to attend your classes. So in AUD, Ambedkar University, we have a provision that if students are not able to attend classes, if students are not able to submit their assessments on time, we can give them as attendance, we can give them extension, we can give the submission deadlines extended. But we need solid proof like a medical record or something. Even if the relative is struggling with COVID or COVID related issues, if they have a solid proof to submit, we can take it, we can consider it. But for this particular thing, how can I ask proof from her? Because that is a totally different scenario of a female. So, but I gave her extension. So in AUD we have that flexibility. Teacher has more autonomy, so I could give that. But I don't think in a normal situation students get that. And similar request I was getting from many other female students. And the students who came to me for counseling were talking about their struggling situations inside the family, their struggling time with their parents. We glorify Indian family system, we glorify our households, but it's not, the reality is not like that. Most of the family atmosphere, most of the households are not that kind of a happy space. So I know students who lied to their parents and somehow they arranged money. And in this pandemic time, even if, even when cases were increasing in Delhi, they traveled from different parts of India to Delhi and stayed in their PGs. And most of them had vacated their PGs when the lockdown started. They came back, rented new PGs, new flats, and they stayed there, only to get a space for themselves. So our students are in such a situation, and we know the kind of protest that JNU students and AUD students and different other campus students were doing in this time to get their own space. So why it is affecting them mentally? What's the impact of not having own space? That's a question, right? So all of us who are in the higher education level are adults. So we need our own space. So this pandemic posed a very difficult and this challenge is very difficult to understand and comprehend. Only those who are experiencing can comprehend it. Yeah. And the changing sense of autonomy and agency, that's also there. So the sense of confinement and the sense of controlling by others, those all are creating different kind of frustrations to us that can lead to mental distress, stress, anxiety, panicking experiences. So how to address these issues at larger level, social level? If we keep addressing this at individual level, we won't reach anything. And the third factor is uncertainties, dealing with uncertainties. Sankamitra ma'am has beautifully pointed it out. And this uncertainties are at different level. When we talk about students in higher education, they have uncertainties stand out from not getting their fellowship on time, their financial uncertainties, to their job uncertainties, right? And many of my students are at undergrad level. They don't know when can they pass their undergraduation. They don't know when can they apply for post-graduation. They don't know when can they start looking for a job. They don't know anything. So these uncertainties, along with financial ones, are very crucial. So how to deal with this? So these are also causing a lot of mental distress to our students. So what brings? So when we talk about this uncertainties, we say that this is normal, this is common to all of us have this. But the question is, what brought this uncertainties to our life? It's not only COVID, it's not only this pandemic, it's about the expectations, social expectations from a student, and the job aspirations, which was designed by the job market, and who was controlling the job market and who is controlling the job market. It's the capital system now, right? And this all together creates this kind of uncertainties. And here I would like to say that even if I say students are a vulnerable session, I want to stress on one thing, that I'm still hopeful about students because they are the most dynamic, they are the most vibrant, they are the most optimistic community. That is why my student could send that video to me. So from all difficulties, they can see possibilities. They try to see possibilities because they have to look forward to their future. They have to look forward to their others' future. They have to aspire for prosperous, right? So they have to find out. Is there pressure on them? They are the learning community, so it's a pressure on them. They have to do it, so they will find possibilities. And that is from my own experiences and the practice experience, I would say that is the only positive thing, I say, a silver lining, I say, when I talk about mental health of students. And with that, they can overcome all these difficulties. But what we need is a collective endeavor, a collective effort, and not reducing these issues to individual level issues. These are part of the larger level socio-political conditions and larger level systemic issues. So when we talk about solution, we always problematize the situation. We don't talk about solutions, or we don't talk about the possibilities. So when I was thinking loud about the possibilities and the solution, I was thinking, being critical on these systemic issues, being critical about this larger level socio-political conditions, which creates those difficulties, is the primary step. If you are critical about it, you yourself can believe it's not my own issue. It's not my fault. I haven't done anything wrong. So self-blaming can be avoided. From my own personal level counseling experiences, I would like to say that everything starts with this personal blaming. So that can be avoided. Right? And next step is how to address it, how to address the systemic issues, larger level issues collectively. If it is not your individual level, it is a collective issue. It has to be addressed in a collective way, right? So next step is for that, how to do it. And this particular session, this conference or this webinar, I would say, it's a small step. That's why I was very happy, and I would like to congratulate the team for that. Just a beginning. We have to go ahead. We have to move forward, and we have to work collectively. And here I wind up my thought sharing. I just wind up my thought sharing by saluting those students who are relentlessly working in this trying time, also working for the rights of students, for getting them a better learning experiences, and who are standing for their own rights and others' rights. They are voicing out, they are questioning the administrations, they are questioning the authorities. So I salute them, and with all respect to this platform, I end up here. We can go for the discussion now.
Thank you, Sunela. Thank you so much. Like you said, we are really hopeful of the student community, because as we have seen during the second wave of the the COVID, though COVID was not only the factor which kind of marginalized the mental health well-being of the students, but COVID did one thing good, that is it brought back the community feeling among the students. It made them a very proactive community, facilitate public health to remotest corners of the nation. So we are a part of the public health delivery system now, a core part. So I think that's the biggest takeaway that we have had. Thank you so much. I would like to thank all our three speakers today, and I would like to request our participants, if you have any queries to our concerned speakers, you can either message them on their personal direct chat boxes if your query is confidential or you're seeking consultation on something personal, or if it's a general query, then you can very well ask it now so that we can all have a discussion.
That not many having questions. I just thought it's a good platform to kind of thank you people bringing these two young thinkers on board and sharing their ideas with all of us. I really feel proud of all of you that you've managed to remain intact amidst all this distress that you've been experiencing. We really have been, it's like coming out from the brink without any, what I think Anandita said in terms of touch deprivation. I think classrooms have been locked for year and a half now. So that touch deprivation has been more than evident in this transaction that we have. So I just want to, on a personal note, I want to thank Sunaina and Anandita for bringing some of these things which perhaps as a teacher I have often kind of negated, even when I perhaps claim to be looking at these aspects. So thank you for bringing that on board and saying it so mellifluously. You made it sound so simple yet necessary. So I think that is something very important that's become the takeaway for me. And I would really sincerely want to thank all of you, not only as the member of the film club, but also as individuals who have become a part of this, this whole agenda, if I can use that word, in bringing about whatever we can, like Sunena said, in terms of ensuring that people don't remain in distress. So as students getting on board with this committee that has been formed, even if it is as late by 1 year, nevertheless, as volunteers, I'm told that most of you have been doing wonderful activities. So I just thought I go on public in appreciating that, especially when we have two invited speakers with us too. So thank you, Sunena, and thank you so much, Anandita. Has she left or she's still around?
No, ma'am, I'm here. I'm listening to you, ma'am. I really want to thank you in the first place for giving us this opportunity and for bringing our observations in. So yeah, thank you, ma'am.
It's really, and I would really feel that as Film Club and as CSMCH Ujjaini, we should keep connected with these young scholars, not only for salvaging us out of our distress, but even as scholars for exchange that we need. Often, touch deprivation has to be visually compensated. Ujjaini, if you're listening.
Yes, ma'am.
So I think that is something which we might want to keep doing as and when we can manage to do.
Yes, ma'am. Sure. We would try to include that as well. So do we have anybody with any queries or questions to our speakers here?
How can I
There is a
reduce my
question in
depression?
chat box, I think, Ujani. It is just
Yes.
a general question. You can see in a chat box without
Yes. Okay.
Somebody
the
asked.
name.
Yes. Somebody has asked about how can he or she reduce their depression during this time.
Does Sunana want to answer it, or will you be comfortable if
No,
I go on with the
you
answer?
go on. You go on. I'll pitch in if it is needed.
Okay, can I get the name of the person who asked the question first?
No, we are keeping it
Okay,
confidential.
right. No, for my own knowledge, right? Okay, so whoever have asked this question, I want to tell you that first try to understand what you are going through and try to make sense of it. And the best way to do so would be, if you're not able to do it by yourself, best way to do so would be to look into your resources, what you have around. It can start from anyone with a knowledge about what clinical depression is. It can be any friend or family member as well who has the knowledge about clinical depression. If you think that is not helping you, and all the self-care techniques that I have shared today, even after practicing self-care, if you feel that that is not helping you, please consider taking professional help. There are mental health professionals, there are psychiatrists, there are psychologists, there are psychiatric social workers who provide counseling sessions. Please consider looking into all these options. And I also know that, taking help, asking help is also difficult sometimes for us. But I would advise you to please tap into all of your resources. So I hope that has answered your question.
Yeah. Another question is there. Yeah, I think Anindita has answered it well.
Yes, we have another
Okay,
question which says, how do I control my mood swings?
right. So the question is, I'm having a lot of mood swings these days, how to deal with it, right? So this is something I feel all of us are going through right now with everything that is going around. Um, so again, I would suggest, take time, sit with yourself, follow that, try to have a conversation with yourself. If it is difficult for you to understand why these mood swings are happening and from where it is coming, try writing down your thoughts. Try writing down your thoughts and try going through it. I'm hoping that that will help you give better perspective about why you're having this mood swings or constant mood changes, right? So also, please make sure to take time for yourself, because this is a very difficult time. And in spite of all that is going around, we are continuing with our daily schedule of housework and being a parent, being a teacher, or being into any other job. We are working from home, and we often do not get enough time for ourselves. We do not get enough sleep. So again, sleep can be a major factor why we often have, lack of sleep can also result into a lot of feelings like irritability and anger. So please try to understand first. Please sit with yourself, look into all these areas, and try to understand whether the needs in this all of these areas are met. Then, if you still feel that after everything you're doing for yourself, it is not working out, then again, I would suggest you to look out for a mental health professional. Thank you.
There are a few more.
Okay.
Yes,
So,
Anindita said it very well. Can I just add, Anindita? Yeah.
yes, please.
So you addressed it well, and this idea of journaling, I experienced it personally, and I suggested this to many of my clients who came for counseling. This journaling technique, writing down your thoughts and making sense of it. When you write down, your thoughts gets more systematic. you get more clarity on your own thought. So the confusing thoughts, the mixture of ideas, everything gets systematized when you write down, when you put down, when you pen down those. So you can make better sense of them. Then that is journaling, thought journaling. So anybody and everybody can use that as a technique to get clarity on thoughts. And mood swings. For mood swings, you can keep a record. How often you get mood swings, right? And is there any particular context or situation which gives you this particular kind of mood swings, right? So when you record them, you'll get the pattern. You can understand the pattern of it. That gives you more insights. So getting that insight is the first step. Then reach out. As Anandita said, reach out to your resources, people who are there, who have better understanding of it, who can, your comfort level is very important. Don't go to anyone, who have zero knowledge about mental health. So go to someone who has better understanding of it. Yeah, that's all. And think that this is not your individual level problem, and don't go for self-blaming. That is self-harming. So don't do that, and that's not right also. That's a wrong thing. It's not an individual level problem. This is a larger social problem. Yeah. How do we
Yes.
as caretakers communicate with people going through some psychological distress without letting our mental health get affected? It's $1 million question, right?
Right.
Anandita, so do you
Right.
want to reflect
Yeah,
on
maybe
what?
I'll begin. I'll try to explain and you can add on, Sunaina. So, first of all, I would like to start addressing this question by acknowledging the fact that taking care of a person with any illness is difficult. It can be a lot to take on sometimes. And there is something which we call in clinical terms called caregiver burden, right? So, taking care of a person who is going through a problem can also lead to us having a lot of issues if we we are ignoring our own needs, and if we do not have to share the caretaking do not have anyone to share that caretaking responsibility. So that can be something. So first of all, please make sure that you have people around you with whom you can share the caretaking responsibility, or even if you feel burdened by taking care of the person who is going through psychological distress, please feel free to reach out to a mental health professional. You should also feel free to reach out to a mental health professional as well, because the caregiver burden is again a serious issue, right? So often it is seen that even in our clinical practice, we have seen that the caregivers of many persons with mental illness, they themselves developed signs and symptoms of depression and anxiety. And thankfully, they have reached out to us and they communicated. And we also, while taking any cases, we also do all the screenings and we try to understand whether the family are keeping well as well. So uh, taking this into consideration, please make sure that take care of your own needs as well. And I would say be very sensitive. Try to be very sensitive about what you're using, what language you're using while communicating with a person having psychological distress. Again, as I said, if you're not sure how your response should be, what you're going to say to the person immediately, please just communicate that, I understand what is happening with you. I cannot respond at this moment right now. I don't think I am in the capacity to respond to this now. I need time to process. I will come back to you. So communication is very important, right? So I think being sensitive, trying to be very mindful about your language, and communicating. These three are key elements to communicate with a person with psychological stress. So Nana, you want to add anything?
This issues of caretakers, caregivers of mental, people with mental distress. It's a real issue, and we don't have proper mechanism to address such issue, right? And especially in this pandemic, it's a very difficult thing because this concept of Goldilocks is there, right? Yeah. So people often use that as a tactic. So this Goldilocks means this can be applied to this particular situation for the caregivers. So the concept of Goldilocks is this: it's all about self-care. Okay, so if you don't take care of yourself, you can't give care to others. So Anandita, in her session when she was talking about this, she explained it well. So take care of yourself and give importance to your own mental health as well. And the concept of Goldilocks is, using all the possibilities of social interaction, through whatever possible means, and through phone or through digital platform, social media, use all the possibilities and improve your social interaction. Otherwise you limit yourself with this distressing thoughts and thoughts about this particular issue as well. How can I manage a person who's going through mental distress, and am I doing it well? So this personal doubts and this constant questioning of yourself, that itself is enough to get into mental distress. So use the concept of Goldilocks and improve your social interaction through possible mediums. Then ensure your own mental health first. Yeah, and if you cannot do something, admit it, because we all are prone to it at any time, at any moment. We all are prone to mental distress. None of us have extra immunity. None of us. We all are human beings. So, and it's not a sin to get into mental distress. So we know that we don't endorse those stigmas and taboos. So it's not your mistake. It's not your fault. Yeah.
Thank you. So, yes, ma'am.
Another question.
Seconds. I just wanted to add in where what Anandita and Sunena just said. In fact, for dementia in the country, we know there's very little that exists in the name of support. The caregiver of dementia, they exchange notes for each other to avoid or kind of overcome this this syndrome that you've just talked about, the caregiver's depression. And the film that I referred to in the beginning, named as Khamoshi, the older one, actually deals with that aspect. How the caregiver, who is a woman, gets inflicted by the same mental health condition what the ill person already had. So I just thought I'll bring in this over here. Thank you. Thank you, Ujjaini.
Thank you, ma'am. Actually, there are more questions coming in, but we have already exceeded our time by more than 50 minutes here. So that is quite a success, I guess. But we are really sorry we won't be able to take any more questions today. If you really have genuine queries, please send it to us. We'll share an email or an email ID or something, some point of contact with you. You can email them to us and we would forward it to Anindita or Sunena when possible, and they can reply if they have the time and the proclivity to. Thank you so much. I would invite my fellow club member, Bornali D, to give us some closing notes on the session today.
Thank you, Jenny. Thank you, everyone. Okay. So, this is a nice talk. So, on behalf of CMCH Clean Club, I would like to thank three resourceful persons: Professor Shangamitra Acharya of CSMCH JNU, Anindita Vishwas of OSTEM, and Sunaina K of Ambedkar University, Delhi, for coming and providing their valuable insight in this topic. I also thank all our participants today who could make out time to join us and enrich our experience. Thanks to the Film Club team and students and faculties of the center for the support. Thank you, everyone. This is very nice.
Thank you. Please stay safe.
Yes, please stay safe. Please stay happy as well.
Thank you. Nice connecting with all of you. Thank you so much. I enjoyed.
Same here,
Thank you,
ma'am.
ma'am.
Thank you.
Thank you, ma'am. Thank you, Sangamitra ma'am.
Thank you
Thanks,
so much.
everyone.
We enjoyed. Thank you.